So today we went to the Children's and Women's Hospital, and there was a lot of different experiences that we had versus U.S. hospitals. For example, one of the things was we didn't see a lot of people wearing gloves. We watched a few IVs being put in, and there were no gloves used in the process. And then in the U.S., that's like a total no-no.
And going off of that, when they were drawing up the medications, they would use the same needle for all of the different vials. So seeing that was very shocking to us.
Yeah.
And as well as we didn't see any bed rails on the beds, and in the US, safety is a huge precaution. So, I mean, if that were to happen in the US,
we would be fired. So there was a lot of differences that we saw today, but overall it was a really good experience.
I was in the ER, and the ER is very, very different from the United States. There's only 2 beds, and then there's one triage unit, basically. They didn't speak to the patients at all. They didn't have bedside manner. So it was kind of interesting, and I kept feeling like I had to go back and pat the shoulder or something and say, it's okay, because the nurse just came in, stuck him with a needle, and went on her way.
One of the biggest differences was that there was no patient privacy. So the nurse had her desk here, and the patients were coming in. They were kind of forming a line, and they all had their paperwork, and they were just putting their paperwork on the table, so they could just see all of the information about the other patients. And there was also no gloves or anything like that, and we could tell that they were using the same stethoscope between all of the nurses, and they weren't disinfecting anything. And also they had just needles wide open in reach of all the little kids that were there. And usually in the hospitals in America, we're used to having the needles tucked away so nobody can touch them. So I think the biggest difference was the patient privacy and the difference in their idea of cleanliness as compared to America's idea of cleanliness in hospitals. But it was a really good experience just to see the difference in the healthcare system that they have here as compared to America. It was very eye-opening, and it makes me appreciate all of the techniques and procedures that the nurses and doctors have to go through in order to take care of a patient, as opposed to the differences that we saw today.